He's going to welcome everyone today.
Hi all. I pray that you're well and safe wherever you are. I also sincerely hope that the sun is shining wherever you are. It's been very wet back here in the East. My name is Robert Boyd. I'm the president of the School-Based Health Alliance. On behalf of our board and staff, I want to welcome you to today's peer-to-peer listening and learning session. We're very glad you've joined us. Today we have representatives from the School-Based Health Alliance state affiliates, state program offices, and some Alliance board members joining us as well. We're hosting these listening and learning sessions every week. Some of you may have participated before. And while the Alliance doesn't have all of the answers, nobody seems to, we want to provide support to SBHCs by connecting individuals like you and facilitating peer-to-peer virtual meetings where SBHC clinicians can come together to discuss and share how you are responding to COVID-19. Please know that there are no right or wrong answers to the questions that we're going to ask today. We're interested in learning more about your individual experiences and, equally importantly, your opinions. I'd like to introduce our three facilitators for today. Andrea Shore, whom you've met already, is our Vice President of Programs. Paula Fields is our Director of Programs, and Miranda Robinson Perez is one of our program managers. Andrea will be facilitating the conversation, and Paula and Miranda will be facilitating the chat box. I'm going to pass this on to Andrea now. Please, thank you for being here and stay safe.
Thank you, Robert. As Robert mentioned, I'm Andrea Shore, and I'm just going to give you a brief overview of today before we dive into our discussion. We're the School-Based Health Alliance, and we work to improve the health of children and youth by advancing and advocating for school-based health care. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack access to health care services. School-based health care is the solution, bringing health care to where students already spend a majority of their time in school. Here's an overview for you of today's agenda. We're going to point to you in the direction of our COVID-19 resources, share some Zoom reminders with you and how we'll follow up with you to today's session. Then we'll dive into our discussion questions and leave a little bit of time at the end for reflection and information about our upcoming sessions. The Alliance remains open and working to meet the new needs of our field. For more COVID-specific information and updates about SBHCs and our Alliance efforts, as well as other partner organizations' resources, you can visit our website. Here on the screen, you'll see a little snapshot of what our website looks like. And we've got lots of resources beyond what you see up here on our page. Today's session in Zoom is being recorded, and we'll share a recording of this session after on our website. And we're also going to send it out and share with you. Everyone's joining muted for now, and we're going to invite you to participate in conversations in a few ways today. The main way is how we began at the start of today, which is using the menti.com platform, either through a new web browser or through your iPhone. And we've put the code for you to type in into our chat box. That's one of the ways we're going to ask you to share your questions and thoughts with each other today. We're also going to give you an opportunity to please use the chat box throughout today's conversations. The chat box is at the bottom of your Zoom screen. You can see a snapshot here. You can click on that chat box and please feel free to expand on any of your answers or ask whomever is speaking to further elaborate. And we will both call out some of those chats as well as invite people to unmute themselves and speak. And you certainly can chime in at any point today by clicking on your microphone and unmuting yourself to speak at any point, and then just please mute yourself again when you're done. After today's call, we're going to send you a follow-up email containing the slides and a link to our COVID-19 resources page. We'll share the recording of today's call with you, and then we're also going to invite you to join Basecamp. You can opt in to join this if you'd like. This will allow for continued collaboration and resource sharing. It's a communications platform that is in real time. You can upload resources, ask each other questions, and continue conversations about a whole host of conversations and questions related to COVID-19. Today's topic is reentry, and there are so many unknowns for reentry. We're all trying to think about this, and we recognize that most organizations and school districts don't have all of the answers yet. Today might be an opportunity to collect your concerns and questions, and then we revisit the conversation later in the summer. But for now, we're looking forward to hearing your thoughts about reentry today, what you're hearing and what you're thinking. Okay, so if you haven't done so yet, please pull up the menti.com website and enter your contact information like you see scrolling through here for others who have started to enter their information. And we'll give everyone a few more moments. I see 31 people have entered so far. And then we'll move on to our first discussion question using Menti. Each time you answer a question today, you will see a button at the bottom of your Menti screen that you'll need to click on to move on to the next question that you will see at the top of our screen. So anytime you're moving on to the next question, you will need to click on the button at the bottom of your Menti screen that will bring you to the next question. But for now, if you can just enter your name and position, and we'll get started in a moment. Great, thank you. I see some people entering their name and contact information to the chat box. That's more than fine. If you are able to get into the Menti platform, that would be fantastic because we'll be able to connect your name with the answers to your other questions. So if you do have a moment, please click on a new web browser or your iPhone, and then you would go to www.menti.com, and then you'll put the code in that you see at the top of your screen here. Great, I see 47 people have logged in. We'll give one more minute, then we'll move on to our first discussion question. Okay, we're going to move on to our next Menti question. And again, please click on the next question button at the bottom of your screen so that your screen is showing the same question at the top of our screen now. So you should see a question asking, how are you feeling about your work in school-based healthcare? We'd like to take a few moments just to ask you to share a few words about how you're feeling. You can continue to enter as many words as you like, and you'll start to see a word cloud form on our screen to give you a sense of what others are saying. Anything that you see large in the middle of the screen means that we're getting multiple responses with those words. Thank you so much for sharing these. I'm seeing hopeful, concerned, feeling neglected by administration, isolated, underutilized, some excited and optimistic. So thank you so much. We appreciate you taking the time to share how you're feeling today. Okay, now we're going to move into some of our dialogue questions for today. We're going to start out by asking you another question in Menti. Please again click to the next question button at the bottom of your screen. If you could please share, what are your immediate challenges, concerns, or fears related to COVID-19 and school-based health center reentry? We'll start to see those responses at the top of today's screen. We see when will school start, right at the center, and trauma as well. We're hearing a lot about that. Uncharted waters and uncertainty, protection of students. School-wide testing. Yeah, thank you. Thank you so much for sharing these. When we move on a moment, we'll ask some questions and we'll start to elicit some answers from you that we hope will address some of the concerns up here today. You can go ahead and move on to the next question, please. Okay, please click at the bottom of your screen, and your next question should say, what are you hearing about reentry? Next, we'll move on after this to what are you thinking and what is your organization thinking? But right now, just what are you hearing about reentry? Schools, school-based health centers? Please share, and then the answers will start to scroll across the screen. Many people saying that they're not hearing too many details yet. No decision on when schools start. New safety measures in place. Someone mentioned social distancing in classrooms. Would you mind unmuting yourself and sharing a bit more about what you're hearing, about how that may work, or if anyone else is hearing that? Please chime in. I'd like to hear what people are saying about social distancing in classrooms in some of these staggering classes. No brave soul who wants to unmute themselves and share.
Hi, this is Megan Sawyer from Nicholas Children's Hospital. I work in the school health program. I'm a nurse practitioner. And what I've heard, mostly from the news, this is not direct communication, but that they're trying to figure out a way to space the desks 6 feet apart, staggered schedules. Some students might come someday, and then maybe some students in the morning, and then in the afternoon they would do distance learning from home. And then no large gatherings in the schools. So then instead of eating in the cafeteria together, the kids would eat in their classrooms. Those are just some of the things that I've heard so far.
Okay, thank you, Megan, for sharing. I also see that someone from Illinois mentions opening with guarded safety measures. Could that person unmute themselves and please share a little bit more about what you might be hearing about guarded safety measures?
Hi, this is Christy from Illinois.
Hi, Chrissy.
I'm not exactly sure what those measures are yet. What we've heard is very vague in nature, but it sounds very similar to what the individual ahead of me just stated.
Okay, thank you. Thank you. I see a few people talking about hybrid learning as well. So adding on to, similar to what Megan was sharing. Anyone else want to share a bit about what you're hearing? About how you'll stagger students or set up different schedules? If you're hearing anything specific that you could share.
I also heard some about possibly keeping kids in one classroom and having the teachers rotate from class to class for those kids who go to different classrooms, just so that they're all kept in one spot. And also, yes, decreasing the number of students in a classroom so that they can maintain the social distancing.
Oh, that's interesting with the students staying put, huh? Thank you. Someone mentioned telehealth up here as well. Does anyone want to share what they are starting to think about or hear about regarding the use of telehealth and reentry?
Our program has actually already started telehealth. We rolled out this past week to provide those services to our students within our Department of Education. So far, parents haven't really been calling in. We've had very few phone calls, but it's a service there to provide because we do have so many kids who have no primary care provider, a lot of students that have no insurance whatsoever. And so a lot of us were already worried about those kids. The word is starting to get out. They are getting the information to the principals so that they can get the information to the parents. But they're talking about possibly having us continue those services through the summer as well.
Right, so you're using via phone right now as your telehealth service.
We use a program, we can use the phone, and then we also have a program called doxy.me, which is through our electronic health record.
Yes.
So we can use either one. I prefer the doxy.me personally.
Okay.
But so far it's gone okay for the few phone calls we've had. I suspect we're going to be getting a lot more because I'm getting some questions from our local schools about registration and what they're going to do about vaccinations and kids not having their physicals.
Yes, yes. And do you mind just sharing your name and where you're from?
My name's Michelle Chapman. I'm in Hawaii, and it's a program called Hawaii Keiki, where they put nurse practitioners in each district in the school.
Yes, thank you. Anyone else hearing anything unique that you'd like to share or expand upon? Okay, I think we'll move on to the next question then, and then we can share a bit more about what you're actually considering within your organization. What are you starting to hear and think about at your clinic level or within your sponsor organization? So we're asking you now, if you click to the next question in Menti, your screen should show what approaches are you considering for reentry? So not just what you're hearing, but what are you tangibly starting to consider? While you're entering this, I'm going to ask Lori to please share, because I recognize her answer in here that she shared on a few other listening learning sessions, and I think it's been really helpful to hear. Lori, if you don't mind sharing where you're from and let everyone know what practices you've put in place and how you're thinking about that related to reentry.
Yes, thank you. Lori Swanson here from Colorado, and I work for Every Child Pediatrics in the school-based health centers. And fortunately, we've had a lot of support in trying to get this figured out, to navigate these COVID waters, which is a challenge. And we have been doing telehealth and telephonic visits all along. And we have the luxury of being located in a temp building for all of our school-based health centers, or at least having an outdoor access. So along with the telehealth visits and telephonic visits, we have continued to do some in-person visits. We've primarily focused these visits on the siblings of our school students who are youngsters who need their immunizations, thinking those, particularly those under 2 or even up to 5 years old, so that they don't fall behind on their schedule. And so we've been seeing them for well child visits in the morning in a clean clinic, and then also doing any other immunizations that we find are critical, and then doing telehealth visits throughout the day as well. And then in the afternoons, some sick visits. Of course, caveat is we're trying to discourage kids with COVID-19 from coming to the clinic. So symptoms of cough and cold, we try to handle through a telehealth visit. And if for some reason we feel we need to lay a stethoscope on the child, we would actually do a car visit even. So these kids would be seen in the parking lot, and maybe a pulse oximeter as well. So let me know if you have any questions.
Yes, and feel free to unmute yourself or type into the chat box if you have any additional questions for Lori or anyone else who continues to share. I see a few people have mentioned some innovations and some new strategies related to vaccines. I saw about a flu clinic and a big focus on vaccines. Can anyone chime in and share a bit here about what you're thinking about reentry and managing vaccines?
This is Kayla from Rochester, Minnesota. I'm a school health program coordinator. We currently run a program where we go within our school district and vaccinate about 10,000 kids within 4 weeks. So we're just trying to figure out what that model is going to look like, and if we can take it to a different venue within our community other than the schools. So just trying to think of different ideas around our current model that we've had for the past 10 years to continue to vaccinate those numbers of kids.
Yes, yes, thank you. Yes, and if anyone has others related to vaccines, or even as someone was mentioning before, the return to school well visits, or any of those traditional services you've been providing for well care. Others starting to have conversations about that and how that might look. Okay. Does anyone have any thoughts or conversations that are starting to happen around restructuring of your clinic spaces? What you're starting to explore in regards to your spaces in the school? See, someone mentioned it on Menti. If you could share some more in your chat box or unmute yourself, I'd love to hear what you're starting to talk about at your SBHC about restructuring the clinic space. And Laurie shares in the chat box that she's wondering if those immunization clinics could be done in cars as a thought. So one thing we started talking a little bit about with sponsor organization administrators earlier in the week was around some of the opportunities to be at the table for these reentry plans that are starting, conversations that are starting to happen in school districts and at the local level. And I'm wondering if anyone has had that opportunity as clinicians in school-based health centers. Have you had the opportunity to be a part of some of the reentry conversations, or see some opportunities to join in and partner with the school conversations, or even larger task force levels that might be happening in your community? If you've had those opportunities or have seen some, please unmute yourself and share.
Yeah, hi, that's Madeline Codina. Everybody hears me?
Yes, hi Madeline, thank you.
Sorry. I did not have the opportunity, but I recently wrote a letter to my superintendent and supervisor, really complaining that I think, given the, the issue of the pandemic, that nurses should be involved. And I will be meeting with my superintendent. I have no idea if it will be fruitful, but I started the conversation at least. So hopefully it's going to a place.
Wonderful.
Thank you.
Anyone else have opportunities like this or have reached out? mentioned being the point person for school-wide COVID testing. And I wonder if you could share about that, as that sounds to me like being part of the larger plan. I don't know what to share about that. I'm going to ask Tammy Alexander from the Alliance to share a little bit about what we were hearing happening through some task force work in Missouri, and a resource that we can share with all of you.
Great. Good morning or good afternoon, everyone, depending upon where you're at. We do have some information out of Missouri, and I will pause just to make sure that Molly Ticknor or someone else is not on the line. Anyone from Missouri on the line? All right, then I'll channel Molly. Molly spent some time with us on the call on Tuesday, and she talked about how the Missouri School Boards Association was tasked by the governor to come up with some guidance around reentry. What's that going to potentially look like? And I will put this information in the chat box. They did come up with a pandemic recovery considerations document. And of course, it will be an evolving document, and it involved a variety of people, including the school boards, the superintendents, principals, even the School-Based Health Alliance in Missouri. And so they're trying to take in a wide variety of perspectives and considerations. And so it's a start as we all wait for CDC to come up with their guidance around school health, school-based oral health, vision. We just need to start finding out who's doing what and what are people saying, and learn from each other. There's an expression that we have in the quality improvement world of we should steal shamelessly and share seamlessly. And that's what we want to do here as part of this listen and learn, is go ahead and share our ideas and steal ideas, because this is such new territory. We just need to do it all. So I will put that really nice resource. It's a good place to start. I would also just take 1 minute for my soapbox that I would love to say to you. As practitioners, as clinicians, probably we might have a few administrators on this call also, but you're all frontline people, and I understand that. I understand your focus is on the kids. I also encourage you as advocates for your kids, for your schools, and for your communities to really start to think of what role do you have in starting conversations. And I loved it that Madeline shared that she started a conversation by using a letter. All of you have talked about ways that you might start conversations about what are we going to do about vaccines. Those are great opportunities to go to your sponsoring agencies, to go to your school champions, to go to your partners, to go to your community partners and say, hey, we're here. This is what we're doing now. And this is what we hope to keep doing, because this is important work. And this is how we're pivoting. Be ready to tell your story. I know many of you might not be comfortable getting up in front of a task force or a commission and telling your story, but be ready. Have your data, have your stories. Be in communication with your sponsoring agency about what they're doing at their level and what part you can support them in communicating. How can you facilitate, the perspective of the trench work that you guys are living in right now, because it is changing. I've seen concerns about PPEs. I've seen concerns about your own safety and how it's going to look for the kids and the rest of school. This is your opportunity. Be intentional, be prepared, and find those places that you can step into and help start the conversation, and be an expert for these people. Be that link in what the kids need and how you see it potentially going. So that's my soapbox. Please continue to share information about how you're making this work on the ground level, because that's the key critical point that's going on. And I will put the Missouri stuff in the chat box.
Thank you so much, Tammy. I do see someone, a few more answers chiming in here too, but any questions for Tammy or thoughts related to that about being able to support any advocacy efforts happening or joining in on those conversations about reentry and partnering with the school? Any questions or thoughts that you'd like to share?
I have one more thing, Andrea.
Please.
Many of you live in states that have a state affiliate. There's probably about 21 states that have official affiliates. There are more that have a point of leadership in the state. And if you're interested, if you don't know who your state leadership is, please get a hold of me. I will point you in the right direction, because they will also be advocating on your behalf. They will be at the policy tables. Some of you have program offices at the State Health Division or the State Department of Education. If you would like links to those, I'm happy to put you in contact, because it's going to take all of us standing shoulder to shoulder to get this to a different place for our kiddos. So happy to help out.
Thank you. Anyone else on that topic? Okay, let's go back to some of the responses I'm seeing on the screen. Several of you have mentioned comments related to infection control, such as managing clinic space, PPE, waiting in cars for appointments. Can some of you share what you're starting to think around that, some more specifics? Parents waiting in the car while kids come in and wash their hands upon entering. Any conversations that you can share around managing your clinic space and infection control?
I'd be happy to share here. This is Lori Swanson.
Great, thank you, Lori.
Yeah, I mean, it's definitely a less than perfect situation. But I can tell you what we have done at our clinic since we have been open the last couple of months. We basically have decided to really put firm controls on who can be in the clinic, when and how. And so basically our front door is locked and people buzz the door, and then the medical assistant with a mask on, a surgical mask, greets them, finds out if they've had an appointment. And if they do have an appointment, they come in and get escorted back to the exam room. Vital signs are taken and whatnot. And then they're to remain there. No one else comes or goes without that strict control. Does that make sense? So they're, then when they come time to leave, we make sure no one's in the waiting room when they're leaving the clinic. So that's one thing we've done. And then we have N95 masks for each provider or MA, and those are to be donned with anyone that has cough, cold, fever symptoms that we suspect could have COVID-19. And otherwise, we wear a surgical mask with everyone. I know we're moving towards getting face shields for preservation of protective equipment for the day. Another thing we've done to help us with infection control is just really relax the dress code so that people can launder their clothes every day or wear scrubs, or if they prefer, they can wear a lab coat that they wash every day. Just trying to find ways to make people feel more comfortable going home after a day of work. We have to remember there's so many people that are asymptomatic that have coronavirus. And so it's really important that people know they need to daily wash their clothes. And then we're cleaning in between patients as well, really cleaning every room, every surface, doorknobs, frequently used areas, bathrooms, with disinfecting surfaces. So I think that's kind of what I'd like to share about infection control.
Great, thank you, Lori. Anyone else want to share about infection control and some of the strategies you're considering?
One more thing is just remembering also that as staff, we can be also carriers of the coronavirus. And so we really need to be wearing masks if we need to be less than 6 feet apart. And so that's pretty much a lot of the day wearing a mask. So basically don a mask when you start the day and only take it off if you're kind of alone.
Yes, thank you. I see someone said, I hadn't thought about relaxed dress code, scrubs. Thanks for sharing. Yes. I'm also wondering, I believe we have some behavioral and mental health providers on today, and what you're thinking about reentry. I saw something about trauma and risk screening up here, and we've heard a lot about primary care, and wondering if anyone regarding mental or behavioral health wants to share what you're starting to think about for reentry strategies, or just early conversations you're having. No one specific on behavioral health. I see Lori called up that someone mentioned less group therapy. Yes. Someone mentioned school-wide risk screening beyond COVID to help capture any new risks like mental health. Could that person unmute themselves and share? One other topic I saw going across the screen was someone mentioned training and activity videos to help prepare families and staff for returning to school. I wonder if that person would be willing to share more by unmuting or entering some more information in the chat room so we can hear a little bit more about what those videos might be that you're thinking about preparing for families and students and staff. Okay, great. I see Lisa Williams responded saying, we don't know specifically what those will look like yet. However, we know this is one of the routes we want to go. Okay, great. Thank you. And Kathy chimed in saying a therapist who works with little kids has said that it will be impossible for them to stay 6 feet apart with a small child in session. Yeah, any other thoughts about that related to the therapy and mental health sessions? Lori responded that parents and therapists could wear masks. Okay, Lisa shared that we also plan to use brief trauma screening, and anyone that scores relatively high will be referred to their mental health partners. Great, and Mary Ann mentions I use mostly play therapy and not sure how that would be possible. Yeah, I saw someone else put up on the screen that they started to remove toys from their health centers. Rearranging an office so my desk separates me from clients. Oh yes, Lori, can you share with everyone what you uploaded onto Basecamp, since there's some new clinicians joining this week, about your your one-time mental health visits so that we can let them know it's on there for when they do join?
Sure. Here at our school-based health centers, we're, aware that there's kind of an emergent mental health concern for our families. And so our behavioral health team wrote up a brief screener that was 3 questions that we're using on every visit, whether it's face-to-face or telephonic or telehealth. And basically the 3 questions are, I know these are difficult times. How much stress are you and your family experiencing? And each of these questions is to be answered on a 1 to 10 Likert scale. Second question, how much family conflict are you and your family experiencing? And the last question is, do you and your child feel unsafe at home? So that any response that's over 5, then we offer a behavioral health provider or a parent coach to connect with them at the end of the visit or in the following day. And so people can say, yes, they want that behavioral health provider to reach out to them.
Great, thank you. And yes, we will definitely send it in the follow-up email. As a reminder, we'll send you an opt-in invitation to join our Basecamp platform, and Lori does have that uploaded on there. We also have a bunch of telehealth resources that we've shared on the Basecamp platform, as that was the conversation of topic for these listening and learning sessions last week. And I see several people have mentioned telehealth on here, and I'm wondering if anyone wants to share what they've been doing for their telehealth practices, particularly if it's something new that you've just taken on. Like I believe it was Megan who shared early on about how that's going, and if you have any questions for your peers about telehealth, and or just sharing what you've put in place as new practices and how that's going. Your telehealth thoughts right now to share or questions? You definitely, if you are interested, can find a whole bunch of resources on Basecamp that we've been sharing from some school-based health centers and from some of the telehealth resource centers across the country. While waiting to see if anyone has anything to chime in about telehealth, I see a few more mental health questions coming up here. Lori, one first question to you is, how do you send those questions?
I actually answered it in the chat, but what we usually do is the MA administers the questions, just asking them directly of the families, are not necessarily written down. Or if we're on a telephonic or telehealth visit, we just ask them as providers as part of our visit.
Oh, great. Thank you. Yes. And now I see that in there. Thank you. And Jessica asked, does anyone have a school-wide emotional wellness screener that they recommend? One that could be completed or scored online. I'm going to ask to answer that if no one has any other thoughts about the school-wide screening. I'm going to ask a colleague to please, Miranda or Paula, if you could put a link to our Hallways to Health resource, our toolkit, onto the chat box. We have a resource from a project we completed just about a year ago. And oh, there we go. And Claudia mentioned it too. One of the resources that we talk about in there is RAPS, which was created by Possibilities for Change. And we also talk about what some other school-based health centers who participated in our Hallways to Health program used as school-wide wellness screenings. The entire project was focused on school-wide and population health. beyond the clinic. So you can find lots of tips and resources in there. So we'll enter the link to that in the chat box in a moment. And yes, RAPS is definitely one of those tools. And I did see a question about Basecamp. We'll send you an invitation to everybody who registered for today in a follow-up email and where you can opt in to join our Basecamp platform. Great. Okay, we've got a couple of screenings being entered, school-wide screenings entered in the chat box. Claudia, you sound like you're a RAPS expert, so thank you for offering to talk with anyone who wants more information. She put her information in here. Oh, she's with Possibilities. There we go. Okay, great. Thank you. So just for a moment back to telehealth, I'm wondering, I don't want to make sure I didn't cut that off if anyone had any thoughts or questions or concerns about telehealth that you'd want to share or ask. I see a question in here in the chat box. We have limited staff at our school-based health center and have been hesitant with administering RAPS to students outside of those who have an appointment. Do other clinics do a mass administration of this? And if so, how do you make contact with all students? Does anyone who's used RAPS want to share? If so, please unmute yourself. It'd be great to hear your strategies.
This is Lori Swanson, and I'll chime in. We don't do a mass administration of a trauma screen to the school. Our philosophy is basically if we don't have the resources to follow up with the need, then we don't ask about the need, because sometimes just asking can trigger it even more so, any kind of trauma. So our philosophy is to not ask unless we have the coverage or the ability to follow up.
Thanks, Lori. So Jesse, this is Andrea again, just to chime in to answer that. If you do take a look in our Hallways to Health resource, I do see Miranda shared it in the chat box. You'll see some of the strategies that the school-based health centers took in order to go beyond those who were in the clinic, because you're exactly right. They needed to really form some champions and support throughout the school so that they were not doing this alone. As they needed to be prepared in the same way Lori was saying, that there needed to be a true plan in place. So they went much beyond the school-based health center staff in order to prepare for school-wide screening and how to respond. Okay, I'm just going to open it up and see if anyone has any other thoughts or questions that they'd like to share. Oh, I'm sorry. I see Erica put something in the chat box here. Behavioral health clinicians who are able to provide telehealth remotely. Are you being asked to plan for reentry prior to the next school year, or are your programs moving forward with making telehealth sustainable for the foreseeable future? see Kathy said nothing's been decided yet. Just to share with you a little bit, Erica, when we were talking to the sponsor organizations on Tuesday, a similar conversation came up, and it did seem like a mixed bag, that it hadn't all been decided yet, but that many were indicating that there was a good chance that if they had added telehealth, particularly through mental health or behavioral health, that they were going to likely keep that as part of their component, that they might turn to what they were calling a hybrid model with some telehealth and some in-person care, but not completely getting rid of telehealth once they went back to school. And I see a few people, yes, chiming in with that. Addie is sharing that we've been planning for keeping both. I have a strong desire to return to in-person visits. And Lori's sharing that their behavioral health clinicians have used telehealth exclusively, but face-to-face may be added. So we've definitely seen a mixed response to it, but have heard that some are going to keep it on, even if they do go back to adding some in-person care. Anyone else want to share about telehealth for behavioral and mental health? Marianne, you mentioned PESI has a telehealth certification. Could you share, what is that organization? I haven't heard of PESI. Or a link to the chat box would be great.
Can you hear me?
Yes, great, please share.
PESI is a continuing education platform, and they offered a telehealth certification at a reduced rate currently. It's a pretty long course. I think it was about 30 hours, but you do end up with a certification after you pass the test at the end of it.
Oh, interesting. And is that for any type of clinician, primary care or behavioral health, or is that specifically for behavioral health?
I'm in behavioral health, I believe. You know, I'm not really sure. I guess I looked at it at my point of view, and I believe it was for just behavioral health, but I can't be 100% certain.
Okay, great, thank you. And I see Lisa saying that, yeah, PESI is also discounting many online courses. Okay, great. Thank you for sharing that. Okay, someone else chiming in that, yes, it's thought to be beneficial to continue with telehealth, although not solidified, so that it could be used during school breaks or when a student's absent from school due to illness. Very interesting.
I just have a quick question, I guess, for the group. My name's Nora. I'm from a school-based health center up in Michigan. We have a pretty big FQHC that we run under, and they rolled out telehealth about 2 weeks before they brought our staff back. So we feel comfortable with the telehealth. I just don't have anyone calling. We've actually just been reaching out, asking if there's any needs. Has anyone had patients that are, you know, the people that are doing telehealth only? What are they calling for? Is everybody kind of slow? We just don't know how to get our patients to need us, because most of the stuff they came down for during school were things that they couldn't manage at home, like simple things like headaches. And obviously when they're at home, they can manage them just fine.
That's a great question. How are you all, and I can share a bit that came up last week, but I'm curious to hear from the group, how are you doing some of this outreach to get patients to start to use telehealth?
Can you hear me?
Yes, great. Please go ahead.
I asked the school to send out like a text blast with information in it saying that I was still offering services and open to referrals.
That's great. So they did it on your behalf to all the cell phones. Great.
Yeah, that's a good one. We did send out, our school uses some like automated telehealth. So we did that, and we also sent flyers out to where they're passing out the school lunches. And then also emailed all the principals in our school district to ask that they post it on the district's website. We just haven't been getting any calls back.
We also have reached out, this is Lori in Colorado. We've actually reached out to our asthmatics, kids with histories of allergies, seasonal allergies, and also ADHD, kids with ADHD, any of those that might be needing medication refills in their follow-up visits, and just reaching out to them and saying, hey, we can do this right now. We'd really rather you especially kept your asthma under control with this COVID-19. So let's talk about how it's going, do the asthma control test, get your meds refilled. And then when we can do an in-person visit and spirometry, we will do that. But for now, we'll take care of it.
This is Samantha. I'm from Missouri. What we've also done is we've had our school-based counselors do like a video saying that they missed them and that they couldn't wait to see them, and that if they wanted to see services like telemedicine, then to contact your adult or your parent to schedule an appointment. And we did get some good feedback from that.
Great, thank you, Samantha. I see a few people mentioning some other strategies here. Someone sharing that health educators who are involved with current school initiatives, such as food drives, pantries, and free meals, will hand out flyers that talk about maintaining open communication. And they're maintaining open communication with the school to inform that they can still refer. So that those health educators use that time to hand out flyers about telehealth. Let's see, then we have someone sharing that the Department of Education announcers offer telehealth services and posted their flyer on their website. Schools are starting to include it in their registration packets, great, and have asked schools to announce on email and text blasts. These are great examples. Any other strategies people are using for telehealth outreach?
Hi, my name is Janet Moses. Can you hear me?
Hi, Janet. Yes.
Hi. What we're doing, I'm a nurse practitioner and I work in Massachusetts. In addition to the school's effort to reach out through student emails and electronic communication, I stay in touch with the deputy principal at our school. And what we've been doing is we've been sharing names of kids we can't reach. And what I do is proactively, I go back 6 weeks in my chart and I just call all the kids because very few are initiating contact, and it's been very fruitful.
Great, thank you. These are fantastic strategies and some of the very same ones that I was going to share that came up last week. And again, I know I keep mentioning Basecamp, but we are having summary reports from each of these listening and learning sessions posted on the Basecamp. So you'll be able to look back to the telehealth report and see any other outreach strategies that were shared. But I think you all captured most of the same ways that clinicians who joined the telehealth call last week shared. A lot of proactive strategies, like you all have just been mentioning, that they were not just coming just because people were offering it.
Hi, Andrea. This is Katie from the Alliance.
Hi, Katie. Go ahead.
Hey, I just wanted to share on that note. I'm also hearing from providers on the behavioral health end who are just sort of thinking about it in a different way. So instead of scheduling a billable session, just doing that outreach, even if it's just a quick call on an ongoing basis, just to touch base with the clients and students on their caseload, to just sort of keep in touch and keep that relationship going. Again, even if it doesn't result in a scheduled or billable service, but maintaining the relationship so that they can continue to provide that support on an ongoing basis, hopefully when we are able to get back in the school.
Absolutely. Thank you. There was one, actually, there was a clinician last week who mentioned that through their relationship with the school, they were able to join some of the virtual classrooms and say hello to some of the students and let them know that their services were available. So they were actually able to join. They could even use it as some health education opportunities, but they could check in at a group level and let them know that telehealth services were available through those virtual classrooms happening with the school. Oh, Kayla, do you mind unmuting and sharing a little bit more about your resource hotline?
Yeah, can you?
Yes, thank you.
hear me okay?
Yeah, I think we can. You were cutting out a little. There you go.
This is Kayla from Minnesota. So our district in Rochester has created a hotline for every school that social workers staff that, so parents can just call. And so there's various needs they cover: basic needs, they cover insurance needs, they cover connection to medical care. I mean, anything that you can imagine, that's why they're there. So it's been super successful. We've messaged out these resource lines through food, so through our buses that are delivering food, Facebook, newsletters, teachers, much like of all the messaging that's gone out that people mentioned before, but we've had a lot of success with these hotlines.
That's fantastic. So is it basically out of like the, is that, and I'm sorry, you faded a little bit for a moment there. So is it a resource hotline where students are calling the school or calling like a 311 or, okay.
Yeah,
okay.
Students are calling the school or parents are calling the school. There's an identified number that they would call. So there's a number for each school.
Great, okay, thank you. These are wonderful ideas. Thank you for sharing all this, everyone. Any other creative outreach strategies? Okay, I'm just going to open up to see if anyone has any other additional thoughts or topics within reentry that you'd like to share or ask about. We have a few more moments before we wrap up. Okay, thank you. And we really do encourage and invite you to Base Camp because we really hope, especially throughout the summer, that this will be a place that all the clinicians who have joined our listening and learning sessions will really be able to keep asking each other questions and sharing ideas and free flow those ideas at any point in time. Okay, so we're going to wrap up today by going to some closing questions. So I'd invite you to please go back to your Menti platform on your other browser or your phone and click on the next question. And then your first wrap-up question you'll see is, was this session useful for you? If you could please take a moment to answer that. Thank you, Lisa, for your shout out in the chat box. Okay, we're going to move on to our next wrap-up question, please. We have a few more listening and learning sessions that we're planning, and we'd like to get your input on any of the following topics that might pique your interest for seeing us cover in these future listening and learning sessions. So if you could take a moment to rank these topic areas, that will help us select our upcoming themes. And then we'll also ask you an open-ended question next in case you have other topics that are not listed here. But if you could start by just ranking these, that would be very helpful. And for those of you who are still on, if you do have a moment, Lisa's asking a question if anyone's doing minor consent, behavioral health, or teen reproductive clinics. If anyone wants to chime in the chat box on that, if you're done ranking. And this is very interesting because your first and second choices on the screen right now are the very same top two that came up on our conversation with the sponsor organizations on Tuesday. So it's interesting to see the same topics. Okay, oh, I still see someone entering here. I'll give it one more minute. Okay, let's go ahead and move on to the next question, please. If you have any additional topics or questions you'd like to see covered in future sessions that we didn't just mention in that ranking question, please go ahead and enter that here. I see the confidential care visits coming up, like was entered in the chat box. We do have some examples of that on our reports from our last listening and learning sessions as well. Oh, great. Lori chimed in with some of what people have mentioned. Thank you. And these are definitely conversations we can keep going with each other on Basecamp as well. Great, thank you. Okay. And then our last question is just, do you have any suggestions for how we facilitate our next listening and learning sessions? Any operations related suggestions for how we are implementing this? We welcome your feedback. Okay, and while you continue to enter that information, we're just going to pull up a last slide for you just to show you our upcoming listening and learning session dates for you to hold on your calendar if you're interested. We have made a slight change in the schedule from what we've advertised in the past. So we are taking a break next week so that we can have a few more people join the week of May 19th that we would like to be participating in our sessions who are not available next week. So please mark your calendars for the week of May 19th and May 21st are the upcoming dates for school-based health center sponsors and then school-based health center clinicians. And as we did with this week, we'll send out an email letting you know what that discussion topic will be. We thank you all so much for participating today. We will send out a follow-up email with everything that we promised at the beginning of the call, and I hope to see you on future sessions. Thank you so much.